Today I'm giving, Madam Speaker, as part of that hope for the future, an update on where we are as it relates to that project. Members will recall that the government committed a significant capital expenditure of between 205 million US and 236 million US over a 5-year period for infrastructure, hospital and health center build-out. I'm pleased to report, Madam Speaker, that under this program, which is the Health System Strengthening Program, 11 of 13 facilities have been designed and are being reviewed now for final approval to move to the next stage for building out. These include, Madam Speaker, the Spanish Town Hospital, the St. Anne's Bay Hospital, Maypen Hospital, and in addition, we have completed external upgrade designs for the University Hospital of the West Indies and also the Cornwall Regional Western Children and Adolescent Hospital in Montego Bay, though that build-out will continue over time. Madam Speaker, let me just give you a synopsis. On the screen, there is a full list that involves several other entities, but let me give you a synopsis of some of the major ones. The Spanish Town Hospital. The Spanish Town Hospital, a Type B facility, has started to benefit from a $2.3 billion upgrade, and we have completed now the designs of the new look Spanish Town Hospital. And that's how it's going to look, Madam Speaker. At the time of its establishment in 1952, it had a 220-bed capacity. The hospital now has 431 beds. However, the population expansion in and around St. Catherine and that community has caused significant overcrowding in that institution. With this upgrade, Madam Speaker, new services are going to be added to the Spanish Town Hospital, including urology, oncology, cardiology, gastroenterology, ophthalmology, and psychiatry will all now be offered in the new look Spanish Town Hospital, Madam Speaker. And by the way, that's not just an artistic sketch. That's how it's going to look when we are completed. That was taken directly from the architects who are working, and we are well advanced. And at a future date, we will unveil all the plans and what it will mean for the people of St. Catherine. Madam Speaker, the St. Anne's Bay Hospital, a Type B facility, has started to benefit from a $545 million upgrade, also in the design stage. The hospital was built in 1929 with an initial capacity of 15 beds. The hospital now has some 308 beds. Like Spanish Town, expansion of the area, greater demands on the system, not much change in the infrastructure. The new upgrade will include physical and functional reorganization of services, a new outpatient block, expansion of radiology, and a new intensive care unit. Madam Speaker, St. Anne and its environs are going to benefit from a new look and a better resourced St. Anne's Bay Hospital, and we will unveil the designs for that in short order. Then we go to the University Hospital of the West Indies, Madam Speaker. The University Hospital of the West Indies has started to benefit from a $4.9 billion upgrade of building and equipment, again, now in the design stage, and that's the actual design. That's not just an artistic sketch. Madam Speaker, a Type A hospital, the University Hospital, was established in 1948 at an initial bed capacity of 200, now increased to 554. The upgrade will include a new 6-story, 120 square feet medical facility, which will accommodate an additional 40 medical and surgical beds, improvements to the outpatient or ambulatory surgery, lecture rooms, conference rooms, and upgrading of the cardiology hybrid intervention surgery room and the neonatal intensive care and administrative department. Madam Speaker, the new University Hospital, Cabinet in fact just approved 3 weeks ago or so the resources to complete payment for the design, and once that is done, this is the external look. The ring road is going to be adjusted, the entrance to the facility is going to be adjusted, but the University Hospital, which is our primary tertiary level hospital for teaching and research, serving not just Jamaica but the Caribbean, is going to have a new look in the years to come to benefit the people of Jamaica and the Caribbean. That is building back stronger, Madam Speaker. Madam Speaker, Western Jamaica, in particular the Cornwall Regional Hospital, has been a source of many challenges related to the main hospital building. This has been a classic case of what happens when you don't maintain your infrastructure. And I'm not prepared to take responsibility on this side for that burden, as some would like us to believe. Because the truth is that hospital, that facility has suffered from chronic neglect over many, many years. And some of the indicators of collapse, and I've seen the documentation, took place when we were on that side and they were on this side. But having said that, not blaming anybody, the truth is, facts are facts. The facility has suffered from major neglect. And we have to fix it. Madam Speaker, let's be clear. Even as we fix the hospital, the services being offered have continued, and that is what is most important at this time to the citizens. Because this argument about repairing and no consideration for the fact that the doctors and nurses continue to serve the people of Western Jamaica is unfortunately doing a disservice to those doctors, nurses, and their support team. Let me give you a little statistics on Cornwall Regional over the last year to show that work is taking place in terms of service provision. 12,600 admissions, of which 7,500 were A&E admissions, performed over 8,000 emergency, elective and outpatient department services. The hospital did over 300 inpatient operations, 1.3 million lab tests, 10,980 hemodialysis sessions, and over 8,000 chemotherapy procedures, and delivered over 3,000 babies over the last year. Madam Speaker, I want to thank the workers, the healthcare workers and their support staff who work at the Cornwall Regional Hospital, and I want to say to them that it will be bigger, better and stronger in the next year to 2 years. We are now entering phase 2B of the project, which will include demolition and structural repairs to floors 1 to 6 and installation of roof on floors 3 to 6. We're also now making preparations, Madam Speaker, to go to the international market for a contractor for the third and final phase to totally rehabilitate and equip all 10 floors of the Cornwall Regional Hospital. Madam Speaker, when this process would have been complete, I'm saying we won't make the same mistake twice. Once we are providing the policy guidelines to that institution and public health. Cornwall will restore its pride as one of the finest Type A facilities in the region. The upgrade will include advanced and completely digitized diagnostic services in keeping with the current international health standards for infrastructure. At the end of the process, we will also have an effective building management system to allow for up-to-date and advanced maintenance services. And all major plants and equipment will be properly managed, Madam Speaker, and a new spatial structure will allow for better infection prevention and control. Cornwall Regional will come back, and it will come back stronger for the people of Western Jamaica. Madam Speaker, Western Jamaica will also benefit from the construction of the Western Children and Adolescent Hospital, thanks to the generosity of the Chinese government. And that is actually a final look of what that facility will be when it's completed. COVID-19 understandably created some delays, but I am happy to report that the Chinese construction team are now finalizing plans to be back in the country over the next 6 or so weeks, and work will begin shortly after. The hospital has a 220-bed capacity, and adolescent hospital will be the only one of its kind in the Caribbean region. It will be the only hospital, Madam Speaker. Bustamante is up to 12 years old. Western Children and Adolescent will be up to 18 years old, and the only hospital in the Caribbean that will treat 12 to 18 adolescent population in a very specialized, focused environment. The hospital will boast pediatric intensive care and high dependency care units, and will have the first pediatric emergency department on the western side of the island. It will also cater for the pediatric population with specifically designated outpatient service, a dialysis unit, and lab services, and cater to the adolescent age, as said earlier. The complex will also, very importantly, This complex, generous gift by the Chinese, will also provide modern housing for healthcare workers who work in the hospital, a major incentive. Madam Speaker, we're building out this infrastructure, and these are only but a few. If you look in your printed copies, you will see a list of other infrastructure development, like a health center in Old Harbour, over $400 million, now in the design stage, in Portmore, in St. Anne, in Clarendon. Huh? Madam Speaker, a significant number of infrastructure that are slated under the IDB project. The Greater Portmore Health Centre, St. Jago Health Centre, Old Harbour Health Centre, Maypen, West and East, Brownstown Health Centre, St. Anne's Bay Health Centre, Ocho Rios Health Centre. Madam Speaker, the resources are in place, the designs are almost complete, and in the next year, or certainly during this period, you will see us breaking ground for the renewal of our infrastructure in public health. We are building back stronger, Madam Speaker. There is reason to be hopeful. But having built out all this infrastructure, Madam Speaker, we also have to ensure that the management systems within the infrastructure works and works well. And so I'm pleased to announce, again, under the leadership of Andrew Holness and this government, over the last 2 years, the government has been working on what is going to be the most significant investment in health information systems, $8.5 million in a digitized, integrated health information system, Madam Speaker. A multi-stakeholder National Health Information System Committee has been formed. And this is really what's going to happen. It's on the screen. Essentially, Madam Speaker, healthcare is going digital. Yeah. That's really what it is. You go to the doctor at a hospital, you came from a clinic, the doctor uploads your information. You don't have to wait 2 hours to go find the paper-based file. It will have your medical history, which medication you are taking, what were your symptoms, how are you being treated, what are you allergic to, if you have x-rays, what those x-rays showed, and the doctor will be able to prescribe, having assessed you in a much more efficient way. It's about reduction of transaction time and cost for the benefit of the Jamaican people, and that is what health information systems will do. Madam Speaker, we're advanced with this, in that we're just about to sign a contract through the government procurement process with a provider to install the hardware, the networking of the institutions. We're starting with 3 hospitals and 9 or 12 health centers. We're linking the hospitals to the health centers within that particular area. The contract has been signed, will be announced soon, for the provider to put the hardware and the networking in place. And then we will go to market after that for the software to be placed for the hardware to give the support in order for the health information system to be put in place. Madam Speaker, there's reason to be hopeful about the future, because if we have that system in place, we can deal with the threats like COVID and other threats that we will encounter going forward.